Hi, I am Wendy Broadwater, and I am going to be talking about healthy weight. Obesity is a rising concern for children and teens, so we will be talking about maintaining a healthy weight, BMI, and stressors that contribute to obesity for children. I'm going to start with just a chart that shows what is healthy weight for children based on age. This is boys and girls, so we could take a look at this just to see an average of what a healthy weight would be for a child based on their age. What is BMI? BMI is body mass index. It is a measure of body fat based on your weight in relation to your height. And this applies to most adult men and women over the age of 20. For children ages 2 and up, we use BMI percentile is the best percent assessment of body fat. Girls and boys develop differently, and they have different amounts of body fat at different ages. So we also consider their age when we look at their BMI. Although BMI is used to screen for overweight and obesity in children, we do not use it as a diagnostic tool. BMI formula is weight in pounds times 703 divided by height in inches squared. So we have a child that is 150 pounds, for example, and he's 65 inches tall. So we would take 65 squared, which is 4,225, and we would take then 150 divided by 4,225 multiplied by 703, and we get 24.96. So that would make their BMI 25. When we look at a BMI chart, that would show that their BMI is 25, and that would consider them in the overweight range. So we would consider that child as being overweight. This chart is also used as a tool. If you don't have the BMI formula available, you can go by their height, which is 5 foot 5 inches, and go over to their weight of 150, and their BMI would be 25, which would show them as being overweight. There are also BMI calculators on the internet that can be used. You just go in and type in the information, their height in inches, and how much they weigh, and it figures out their BMI formula without using the calculator. Those are available online as well. The next I have is CDC recommendations. These are just charts that are used to show the percentile for boys and girls ages 2 and up to the age of 20. So this just shows examples of a boy and a girl where they would be considered on the BMI chart. Doctors use these in their offices as well to show whether or not a child is obese or overweight or considered normal. Some stressors that contribute to obesity include family stress. This includes parental disharmony, such as divorce or issues in that manner, as well as academic stress, peer relationships. Boredom is a big thing that causes children to eat, and lack of sleep. So these are things to consider when we are thinking of obesity in children. Obese children are targets of social discrimination. This also is a factor that causes obesity. Low self-esteem can affect social and academic functioning, and this can persist in adulthood. So we should consider that when we are talking about obesity in kids. Maintaining a healthy weight is very important. It is important for heart health, and research shows nearly 60% of overweight children had at least one risk factor for cardiovascular disease, and 25% had 2 or more risk factors. Also, obese children have an 80% chance of staying obese their entire lives. Childhood obesity may also lead to significant health problems, including type 2 diabetes, asthma, sleep apnea, psychological stress, including low self-esteem. Something to think about. Maintaining a healthy weight is not always easy. It is the key to success is making changes in daily eating and physical activity habits that can be maintained over one's lifetime. Teaching children healthy eating habits is setting them up for a lifetime of healthy eating and living. These are skills that children should be taught, and they learn these and make them better to know good food choices and what they should be doing when deciding what they should be eating. So small changes can have big results for children. I would say that making a little change here and there has a big effect in maintaining the results in the end. So taking away computer time or TV time 5 minutes a day can lead to more physical activity, and small changes like taking away some sugar or soda can also help maintain that healthy eating habits in the long run for children. Some references that I used to help determine the BMI and obesity are also included here. So I hope that this is all helpful in maintaining a healthy weight and what you need to do to continue to gain knowledge in maintaining a healthy weight and lifestyle will be very beneficial in your lifetime and maintaining your overall health. Thank you, and I hope you have learned. And if you have any questions, please ask.